Hey, health warriors! When you're caring for elderly or chronically ill patients with heart disease, every small action can make a big difference. Whether you're a nurse, caregiver, or healthcare aide, understanding the unique needs of cardiac patients, especially older adults, is essential to preventing complications and improving quality of life. Today, we're breaking down practical, real-world strategies to help you confidently care for cardiac patients. Why elderly cardiac patients need specialized care. Cardiac issues in elderly or chronically ill patients like heart failure, arrhythmias, or coronary artery disease don't show up the same way as in younger adults. With age and illness, the heart becomes more fragile and symptoms can be atypical or masked by other conditions. Add polypharmacy, mobility issues, and cognitive changes, and your patient is at higher risk for fluid overload, medication mismanagement, falls, respiratory distress, and sudden decompensation. What nurses and caregivers need to watch for: daily weight monitoring. Sudden gain could be fluid retention, a red flag in heart failure. Vital sign trends: watch for low oxygen saturation, bradycardia or tachycardia, narrow pulse pressure, and irregular rhythms. Early signs of decompensation: fatigue or confusion, new or worsening shortness of breath, swelling in legs or abdomen, and decreased urine output. Medication safety: be alert with diuretics, as there's a risk for dehydration and electrolyte imbalance. Monitor beta blockers and ACE inhibitors for hypotension, and ensure patients aren't skipping anticoagulants or statins. All right, here are 5 key interventions for better outcomes. First, keep the head of the bed elevated to help with breathing. Next, encourage light activity within tolerance to prevent deconditioning. Then, ensure low-sodium diet compliance. Partner with dietary staff and family. Also, check daily weights and input-output for fluid balance. And finally, communicate changes early. Don't wait for a crisis. Bottom line, be the heart behind the care. Cardiac care isn't just about monitoring machines or passing meds. It's about watching closely, thinking critically, and acting early. As nurses and caregivers, your skill and attentiveness can literally save lives, especially in our most vulnerable cardiac patients. What's your top tip or experience when caring for elderly heart patients? Drop it in the comments below. We're all in this together. Like, share, and subscribe for more frontline care tips that empower you to provide excellent, compassionate care, one heartbeat at a time. And remember, lead with heart, care with purpose.